Hello again, it's Tim Spector from the ZOE Symptom Study app, and it's been a really busy week, and I want to just give you a quick update on where I think we are, what our data is showing. Rates across the UK have been going up, and we've now hit 68,000 new cases daily, which is not good, which means nearly 750,000 people currently affected with the virus, and now nearly everyone out there knows somebody who's been affected, which wasn't always the case. The worst hit areas have been Wales and London and the southeast. And in Wales, the good news is that the peak seems to have passed and rates look as if they're about to start dropping. And I think we can use Wales as a bellwether of what's going to happen to the rest of the country. In London, rates are still going up, but the R value has dropped from 1.4 to 1.1, so that rate of increase isn't as big as it was. Now, this means that about 1 in 40 people in London currently have the virus, which is a lot, so the risk of getting infected really is very high. So you do need to take extra care. Hospitals are struggling in London and the southeast with occupancy rates due to COVID around 40%, which is very high indeed. But on the other hand, we are seeing fivefold differences between the worst areas like London and some of the best areas like the southwest of the country or the north of England that bore the brunt of the problems later last year. So depending where you live, you're going to have a very different type of risk at the moment and paying, in a way, a different game in this national lockdown. Now, when's it all going to end? Then what we're seeing is once we see rates dropping on our new daily charts, it's going to take a couple of weeks until that feeds through into the NHS admissions. And so if we look at the London rates, we're predicting that in about a week's time they should peak, which means in around 3 weeks we should start to see the hospitalisation rates steadying and starting to fall. If that is correct, and that's borne out in the rest of the country, which don't approach the London levels because they're starting much lower, then I expect we might see an earlier end to this lockdown than has been talked about, which would be great. Now, the vaccines are the other big story here because the UK has done particularly well compared to other countries in terms of producing and getting these vaccines out to people, and I managed to vaccinate a million people, at least for a first dose, and most of them are healthcare workers, although they aged over 80. And even my mum managed to get one in her care home today. Now, the app now has features for recording vaccine use, and this is going to be really helpful on the ground. Over 21,000 of you who are actually logged having a vaccine, and we're carefully monitoring things like side effects and how many of you might get infections of COVID in the first few weeks when you're not fully immune. So we'll keep you updated on that and on the rate of vaccination around the country. And finally, as most of us are facing several weeks of fairly grim lockdown, do remember there is a positive side to this. In the last big lockdown in April and May, we found that about a third of people did worse. They put on weight, they didn't exercise, they had poorer diets. But a third of people did better and actually used that time to improve themselves. So I'd like all of us really to think how we can get into that improver group even in these dire situations. So do remember the importance of improving your diet, eating plenty of fresh vegetables and fruits, a diverse diet to help your gut microbes, which will also help your immune system. Getting out and exercising more in the fresh air, really important. And that's all part of the third part of this, which is your mental well-being. Make sure that you don't get too depressed and that you stay upbeat. Use things like meditation, yoga, whatever it takes, just calling friends up and help each other out. Because if we do this right, we can get something positive out of this mess. And by sticking together, I think we can get through this. So thanks for your attention. Happy New Year. Keep logging.